Hello everyone. This video lecture is on the chapter of death and dying. In this video, I want to introduce the topic, talk about the definitions of death, discuss how different stages of the life course may approach death differently, get into some cultural responses, and maybe get into the topic of grief. So in your first box here, you'll notice that it offers two definitions or two kinds of death. We have both functional death and brain death. So if we were together, I might ask you, when do you think death occurs? Functional death is defined as when the individual no longer has a heart rate or no longer has a heartbeat or is not breathing. So it's effectively when the body has quit circulating blood and oxygen. Brain death is considered when there is no brain activity. And I trust that you realize that your body can continue, your heart rate can continue to beat, but you can lack brain activity. Now, when there is no brain activity, yes, right, you can, because it's the cerebellum that regulates heartbeat. So the question would be, if we were together, when are you said to be dead? Is it when you no longer have a heart? Because the machines can keep your heart rate, can keep your blood pumping, but it can't revive your brain activity. And then the question, and the reason we discuss it, or the reason that this is significant, is because with technology, this is a great example of what sociologists call cultural lag, where we have the technology to keep the body alive, but we haven't quite figured out in our culture, our beliefs and our attitudes about how long we should prolong or keep the body alive. So later in the chapter, we'll talk about a case, Terri Schiavo, and she was a young woman. You may be familiar with her case, but she was a young woman who, I believe she was in a car accident, and the machines kept her body could breathe, but she was effectively brain dead. And so there was a lawsuit. The man that she was married to sued because she couldn't feed herself, so the only way she could keep her body alive was for someone to feed her or to be tube fed. And so her husband filed a lawsuit to stop feeding her, effectively to let her starve her to death, because she was not, the doctors believed she would never her brain would never heal. So anyway, the point is it raises this ethical question, and that'll be one of the topics we get to, is the difference between functional death and brain death. So then the slide,
11 o'clock.
Also discussed in this slide, is how different stages of the life course approach death differently or respond to the topic of death or the phenomena when someone they know dies. So death in infancy is far more likely from SIDS and miscarriage. Childhood, as we've already talked about, the number one cause of death in childhood is accidents. Adolescents regard themselves as particularly invulnerable, invincible to death. They're also more likely to be killed by accidents. They're often risk takers. Young adulthood, according to our textbooks, young adults are difficult patients. I certainly I can see this in some of the young adults that live with me, that we had some rows earlier, all in this social distancing, this pandemic thing, and they just didn't understand why I didn't think they should be hanging out with their friends. And then when you get to my age, and this makes perfect sense, because when you get to my age, you become a little bit more afraid of death. And then by the time you get to my mother's age, my mother is 73, so your grandparents' age, by the time you get to that age, your body has started to experience what your textbook calls your terminal decline. So you've begun to experience some of these your end of life changes. So your cognitive skills aren't as sharp. You may be sick more often. You're losing some of your physical mobility. And so your attitude towards death begins to change. So young people, young adults, early adulthood, right, make difficult patients. They're, I don't want to say it's in denial, but there is this sort of element that it doesn't happen to people like me. And then when you get to my age, when you get to your mother's age, you're nervous about it, right? You get a little bit more anxious about the possibility of death. And I think I think that by the time you get to my mother's age, it's not as frightening. And my mother has said lately, "Don't let me get to that. I don't want to be the 96-year-old lady who can't hear conversations and can't participate." So by the time you get, it's not that you're welcoming death so much, but I have heard of old ladies who say, "Oh man, I woke up again, didn't you know?" Okay. So anyway, so that's the point. Moving down to the next slide. This one just offers us some different cultural attitudes or perspectives. There's actually the study that and I tried to look up how to say this precisely on Google, but I couldn't, my computer wouldn't tell me what it said. Thantology, which is the study of death, the study of the cultural attitudes towards death, the process. I, for one, have always found the process of death to be fascinating. I remember reading in a sociology textbook, they said that Americans are a death denying and a death defying culture. So if we were together, I might ask you, have any of you sat at somebody's deathbed? And a couple hands would probably go up. Some people probably, but most of us have not. Most of us have not actually seen death happen in front of us. Or because what our culture has done is we have moved death and dying to the hospital. We don't, once upon a time it happened in our homes, right? You were born in your homes, you died in your homes, but now death happens away from us. So that means we're less we're less comfortable with it, and we're more afraid of it. We're and in the video, oh, hopefully I can find it. There's a 60 Minutes video where they describe how in the last 6 months of life we spend something like 75% of healthcare is spent in these last six, just trying to eke one more day out of our life, right? And that's because we try to be a death-defying culture. One thing that I appreciate in this chapter is the discussion about having a good death, what that means. And in the video that I make reference to, the commentator says, is, we think that the worst thing that can happen to us is that we can die. And he says, the worst thing that can happen is you can have a bad death. Okay, so and that's one of the things that we talk about with different cultural attitudes. Mainstream American culture is this death denying and death defying, but yet other cultures see death as a liberation, as a freedom. I remember many years ago I was discussing or describing how I was describing this phenomena, and a student pointed out in her paper. She said that in her family, in her culture, we cry when a child is born and we celebrate when someone dies, because their culture sees death as this liberation away from pain and this freedom from this painful life that we're currently living. And I've thought a lot about that. I think that does make some sense. Okay, so also this notion about death education. Our culture doesn't have one. I argue that we have a rite of passage for the living, but we don't have a rite of passage for the dying. At least in my lifetime, there has been some attention to that. Hospice does some of that sort of preparation work, but death is just, when was the last time you had a conversation with somebody about, have you had a conversation with your family about what kind of death you want? Have they had the conversation with you? So the assignment that I have put up with this particular chapter invites you to do that very thing. And it invites you to write a letter to your loved one about what kind of death you want. I like to say, if you truly love someone, don't put them in a situation where they have to figure this out. And this is, my husband and I had a very short conversation about this the other day with this whole pandemic stuff and everybody talking about ventilators, and we discussed, like, what kind of intervention do you want? I said, don't put me on a ventilator. If it's getting to that point, I said, just don't do it. Don't waste a ventilator on me. So the point is that this is a conversation. We are all going to die. 100% of us are going to die. And we shouldn't attempt to ignore it because it's going to happen. All right, I'm going to wrap this chapter up here, this lecture up here. And in the next one, we're going to talk about the stages of grief, a little bit more about death with dignity.